Hi everyone, today I am giving you information on the topic installation of eye drop. So let's move to its definition. Installation is pouring or injecting a substance drop by drop inside the eye. The word installation is simply means we are pouring or injecting a substance inside the eye which is drop by drop. When we are talking about the installation of eye drop, then we are putting the eye drop inside the eye. Next one, this one is the setup when we are putting the eye drop inside the patient eye. This one is the examiner's right hand and the thumb of the right hand, and this one is the index finger of the right hand, and this one is the left hand, and this is the thumb of the examiner. So by using the thumb of the left eye, the examiner is pulling the lower lid of the patient and forming a pocket like this. This area is known as a pocket, and we are supposed to put the eye drop here at this part. Okay, so this one is the setup of the patient and examiner. Instructions. Now what instructions should be taken before and after putting the eye drops? Wash or sanitize your hands before and after too. If the examiner is putting the drops, then he or she have to wash his or her hands or sanitize his or her hands before and after too. If the patient itself or himself putting the eye drops, then he or she have to wash his or her hands before and after too. Next one, position the patient comfortably with his or her head supported. So the position should be like that which I have shown. He or she should be sit comfortably. Okay. Next one, ensure good lighting. There should be good lighting. So we will see where we are putting the drop. We are supposed to put the drop by forming a pocket. So this should be maintained and ensure a good lighting, so that we will get to know we are putting 2 drops, 3 drops or any 1 drop, and where we are putting a drop. Next one, explain the patient what you are going to do. Always explain the patient what you are going to do with him or her. Next one, purpose. Now what are the purpose why we are putting the drops inside the patient eye? There are the different reasons due to which we are giving the drops to the patient, so he or she can relieve from some conditions, or we are supposed to put the drops inside the patient eye at a time. So first one is the treat infection. Different kinds of infection takes place inside the patient's eye. So bacterial infection, viral infection, fungal infection, these are the different infections. Next one, to dilate. To dilate the patient, we will use the dilating drops. So dilation is very important when the patient is suffering from any kind of systemic disease like the diabetes, asthma, thyroid, hypertension. So to rule out that when the patient is taking prescription since a long years of time in his or her life, then we are supposed to rule out that any side effect takes place on the patient eye or not. Okay, so to examine the retina of the patient eye properly to rule out is there is any sign of diabetic retinopathy, hypertensive retinopathy, tuberculosis, so we are supposed to dilate the patient first. Next one, to relieve pain. If the patient is suffering from any kind of pain, then we will prescribe the drops to the patient to relieve the pain. To relieve from itching, irritation and watering, these are the conditions, so we will prescribe the drops to the patient. Next one, to relieve from foreign body sensation. Sometimes the patient feels that any foreign body enters in his or her eye. It is just a feeling that something is enters in the eye, but it is not true. That condition is known as foreign body sensation. The patient feels like something enters in the eye, but this is not true. So to relieve from this condition, we will give drops to the patient. Next one, to stain the cornea. Sometimes we are supposed to stain the cornea to rule out that is there any scar, abrasion, something takes place on the skin, or sometimes the skin of the cornea gets washed out or scrub. So to stain the cornea, we will use the drops. Next one, lubricating eye drops. Lubricating eye drops are given to those patients whose screen using time is very much, for example 7 to 8 hours a day. So to avoid the dryness, we will give lubricating eye drops to the patient. Steps. So what are the steps? Starts by tilting the patient head backward while sitting, standing or lying down. First of all, tilt the head of the patient. Allow him to sit comfortably backward while sitting, standing or lying down. Okay. Always Allow the patient to sit down and tilting his or her head. With your index finger placed just below the lower eyelid and gently pull down to form a pocket. So we are supposed to follow this step with the help of examiner's index finger. We are supposed to pull the lower lid of the patient and form a pocket, and then we are supposed to put the eye drop inside the patient's eye. Ask the patient to look up. Ask the patient to look at the upside. Okay, squeeze one drop into the pocket at the patient lower lid. By forming a pocket, squeeze only one drop at the patient's pocket of the eye. Ask the patient to close the eyes for 2 to 3 minutes. Okay, let's move to the next one. Points to remember. So what are the points that we are supposed to remember? First of all, check the expiry date of the drop. First of all, check the expiry date of the drop. Do not touch the tip of the bottle with any part of the eye of the patient. We are not supposed to touch the tip of the bottle with any other part of the eye or the patient or the examiner. Make sure the tip of the bottle is clean, okay, to avoid any kind of infection. Patient should not blink or wipe the eye after putting drop. Next one, optional tip. This tip is totally optional. Gently press on the side corner of your closed eyes with your index finger and the thumb for 2 to 3 minutes. So this optional tip is used for the patient if the patient wants to use it. He or she can use, otherwise it is an optional tip. So like this, with the help of index finger of the patient, he or she is supposed to press here by closing the eyelids. This is used so that the drop will drain into your throat. Normally when we put any kind of drop inside our eye, it regularly or it by default comes to our throat. So to check the passage is clear or not, this step is done. Next one, if your hands are shaking. Now this is for the beginners. If the hands are shaking while putting the eye drops, what you have to do, try to approaching from the side. Okay, by not using the you can also use two hands for doing this, or you can also try to approach from the side if you are not supposed to put the drop properly from the center, so that you can rest your hand on the patient face, which helps to steady your hand. So that you can rest your hand on the patient face. Try to approach from the side so that you can rest the our hand on the patient face, so that your hand will remain steady, so that the whole weight of the hand comes on the patient face. Next one, if you are not sure that the drop get inside the eye or not, then put one more drop, because eyelids can hold only one drop capacity, so that any excess will just run out from the eye. If you are not sure that is the drop get inside the eye or not, then you are supposed to put one more drop inside the patient eye, because the eye have the capacity of putting only one drop and the another drop will get run out. Thanks for your patience listening.